I think the biggest thing that we want to accomplish at Philips with telehealth is really improving outcomes and care of our patients, helping providers do their job more efficiently. So everything we do is trying to really improve how they work and the outcomes and benefits that all the people and patients will get from the services. So population health analytics in hospital to home is really about leveraging telehealth for population management of our patients across inpatient and outpatient areas. And so we work a lot with how do we identify how to prioritize patients, improve resource allocation with the remote care teams, as well as improving outcomes and reducing costs in management of patients both in the inpatient and outpatient programs. Much of our focus is around improving operational efficiency and improving outcomes with our telehealth programs. So in terms of trying to figure out how do we prioritize our teams, make sure that they can provide attention to the patients and people who need care the most and most urgently. Some of the questions that Philips Healthcare pursues in population health analytics is really helping our telehealth teams identify which patients they need to prioritize and give certain treatment pathways to. So trying to efficiently allow the team to identify which patients need care at that moment and what type of care pathways they need that are going to be most effective to improve outcomes. So we do that both in the inpatient side and on the outpatient side. In the inpatient side, we have algorithms that re-stratify patients, help identify their need for ICU care, so that helps with ICU resource utilization. Also in the eICU side, we have algorithms and tools that help manage resources of the eICU staff. So how do they allocate their time and resources into which patients they're going to spend the most attention to, since they're monitoring such a large population of patients at once. You go into the outpatient side, we're really doing that risk stratification as well, mainly right now focusing on which patients get entered into which programs. So we want to make sure that patients are going into the right type of telehealth programs that are appropriate for their needs and their level of care, and they are tied back to the interventions that those telehealth programs are designed to support. So we really want to make sure that we thoughtfully bring the right patients into the programs, that those programs can help support and make a difference. So the EIC Research Institute is actually a great example of what happens when you get a community of different Philips customers together, and they all collaborate in a way that really advances medicine. So all of our eICU customers, the majority of them have agreed to share their de-identified data together, and we leverage that aggregated data set for research, both to advance critical care research, but also to fold back into our products and develop better tools that go right back into our customers. So right now that database sits at well over 3.5 million ICU patients with very detailed clinical information and data. So it's really a tremendous resource in terms of advancing critical care knowledge. The partnership we're doing with MIT in regards to the EIC Research Institute is really to help take the ERI and advance it more with the public and get more crowdsourcing, which really starts getting more people involved and able to use that database for research so we can all advance a little further. The MIT team will be helping to support researchers all over the world, tapping into that data to derive more knowledge and research that everybody can share.